going to kind of continue talking a little bit about weight loss because last time we got directed to other things, which was fine. Weight loss is such an important thing, and it you know, at the first of the year, everybody wants to lose a few pounds and get where they want to be, and a lot of us, we lose it and then it comes right back on, and there's reasons why that happens. We focus our brains on certain things, and it takes literally 6 weeks to make a habit become ingrained into our subconscious. And that's due to the reticular activating system in the brain. We have to get beyond that to get new programming in, and it takes 6 weeks of work of doing the same thing every day to make it into the subconscious and make it a subconscious effort instead of a conscious effort, because conscious effort is very fatiguing. It takes a lot of work, a lot of daily progress and effort that is continual. And then once we make something a subconscious effort, then it becomes more effortless and becomes a habit. One of the things that I do, you know, when my pancreas failed last April, I had to put myself in a different sort of diet that had no sugar, because sugar would raise my sugar levels and I'd have to take more insulin. And when I came out of the hospital, I was insulin resistant. So I was taking 95 to 100 units of insulin every day. And it was ridiculous. And I wasn't weighing that much. It's because my pancreas quit working and my cells were toxic. And so I had to do several things. Number one, cut out the sugars. And that made it so I could take less insulin. But the other thing I had to do was detox my cells, because when I became very sick, I was on a lot of antibiotics and medications, and literally I had a near-death experience April 22nd of 2017. And in order to come back, I had to come back into a body that was pretty much dead and non-functional. My liver had quit working, my pancreas had quit working, my kidneys had quit working, and so, you know, I was in bad shape. Even my thyroid had quit working, and I had quit producing insulin. I wasn't making enzymes anymore to even digest food, and so when I came home, I had to literally take enzymes to even absorb food, take insulin so I could get the sugar into my cells. And I was a pretty sick puppy. And so I did some detoxing, which involved helping my liver, my kidneys, my colon. All of my internal organs had shut down, and so I had to restart them. And keeping the sugar clear down helped me get the sugars lower in my body, because every time I'd eat any sugar, my sugar would just spike really high. So I had to avoid sugars completely and start on a diet just of fats and proteins. But in order to absorb the fats and proteins, I had to take enzymes to even absorb them, because I wasn't producing enzymes in my pancreas either. And so I started this long haul of getting back into shape and alive and having my organs work. And currently, I'm about 65% of what I was a year ago even. And so when I started using the insulin, I started gaining weight again. So I went from 182 pounds up to about 195, and I kept lowering my insulin dose because I didn't want to gain any more weight, because my best weight is about 196 pounds. And so in order to keep from gaining any more weight, I kept lowering my insulin. And I got down to the point where I was only taking 25 units a day. The normal human being needs at least 30 units a day to keep the sugar levels down, but my sugar levels were bottoming out every day, and so I kept going down on my insulin, which meant my pancreas was starting to function again and produce enzymes and insulin. So I was really happy about that. Now, what does this have to do with weight loss? Well, it has a lot to do with weight loss, because not only was I getting rid of parasites, fungus, and virus, and bacteria, because bacteria had caused my problem in the first place, and I had gotten toxic, so I needed to remove toxins from my body too. And during that time, I had got, because of the antibiotics, I was overran with fungus and got some viruses that caused trouble, and then I got infected with parasites. And so, you know, here I am. I'm one of my own patients, and luckily I know how to treat these things, so I started treating all of them. But detoxing, I was really focused on detoxing, because I had become, my cell membranes were full of toxins, and so I had to do what we call a 90-day detox, which removes heavy metals, petrochemicals, even anesthetics, because I underwent a couple of surgeries on my ear to drain the infection, and had to undergo anesthesia, which toxes up your liver and kidneys. And so I started the 90-day detox. And let me tell you, that started helping lower my insulin levels even more, and helped my liver and pancreas feel better, because I removed the toxins. Now, why do people not lose weight? Because they're loaded with toxins. First couple of weeks, we'll get on a diet in January and we'll lose 5, 10, 15 pounds, and then all of a sudden it becomes very hard to lose the weight, because it starts coming back on. Why? Because we store the toxins in our fat cells, and when we start burning those fats and losing weight, we release those toxins. And if our liver, kidneys, colon, and lungs are not releasing those toxins, our body will push us to gain weight again, to put the toxins back in the fat cells, away from our vital organs. So if you're one of these people who can start losing a little weight, and then all of a sudden you just gain it right back, you are full of toxins, chemicals, pesticides, herbicides, you know, those kind of things. And Systemic Formulas came out with a really great 90-day detox back in August of 2010. And that's when I started going to Fairfield, Iowa, because Maharishi Mahesh Yogananda came to me and told me to go to Fairfield and detox my people, because Monsanto has most of their chemical experimentation land there in southeastern Iowa, where they use Roundup and Dicamba, 2,4-D, and many other new types of pesticides and herbicides. And they also experiment with genetically modified foods, some that are somewhat tolerant to some of these poisons. And so the people there were very toxic, and I was able to detox them and get the chemicals out of them. So, and when we get the chemicals out and the toxins out of our body and the heavy metals, we can lose weight. So if you're one of these people who just can't lose weight, consider the 90-day detox, because the first time I did it, I actually was able to get down to a more normal weight. and I got plastics out of my system. I got heavy metals out of my system. I got all kinds of herbicides and pesticides out of my system, and so it worked very well for me. And so I became somebody who testified that this worked because it worked so well for me, and it made me feel a lot better. But I again had to do it this last year because of the infection I got from falling down and hitting my head and causing an infection to spread in my head, and it went down into my body and put me into sepsis. So I was in septic shock by the time I went to the ER. And the only reason I went is because I knew I was going to die unless I got some immediate medical attention. And so I followed my intuition and went in and let them work on me. But I had to be on IV antibiotics. I had to have surgery, which anesthesia is one of the most toxic chemicals. When I did my anesthesia rotation, they would talk about there was a level which would kill a person, and there was the level which would anesthetize the person, and they weren't very far apart. So you had to keep people right at that level. And when I did my rotation, they didn't have the nice devices that monitor the patient so closely back then. So we had to monitor them by taking their pulse and blood pressure and watching their breathing very carefully as we were working with them. And if anything varied at all, we had to lower that anesthesia because it could kill them. So, getting exposed to these things does a lot. And it's one of those things that you don't want in your life, but sometimes it happens, and sometimes we have to get those chemicals back out of our body, or they will cause problems. Now, another thing that I went through is I still had some amalgams, or the dark material that they use to fill in your teeth when you get cavities. And I had some of that removed because of the toxicity of the nickel and mercury that is in these. And so by removing that, it made me, get the Mad Hatter's disease, where you kind of go a little bit crazy. And so I had to remove the mercury out of my brain and do another type of detox called chelation therapy that removes heavy metals. So the 90-day detox is really good for removing petrochemicals, herbicides, pesticides, petrochemicals, those kind of things. But the other one that is used is a chelation therapy that helps remove heavy metals. Mercury, lead, arsenic, cadmium, those kind of things, because they can cause trouble with your body also and lower your immune response. So detoxing sometimes is very important in order to lose weight, because when you start to lose weight and release those toxins into your bloodstream, you can hurt your organs and your body will fight against you. So in talking about weight loss success tips, we actually developed these weight loss drops that affect the hypothalamus and the thalamus, where the leptin receptors are. Now, leptin receptors are what they call the satiety receptors, because they get bound when you get enough nutrition, and it gives you satisfaction or satiety. You feel satisfied that you've eaten enough. Now, sometimes when we're not getting enough nutrition, because a lot of our food, it's got a lot of calories, but it doesn't have a lot of nutrition. And so when we eat food that is not nutrient dense, we have to eat more of it. And a lot of times it's calorie dense instead of nutrition dense. And so what these weight loss drops do is they make you feel full, like you've got your nutrition in you, and so it gives you satiety. And then it also helps the fat cells release the fats into ketones. Now, ketones are kind of interesting. I went into what we call a ketoacidosis, a diabetic ketoacidosis, which is very dangerous because you lose a lot of potassium and you lose, I lost a lot of magnesium, a lot of electrolytes in general. My electrolytes were totally messed up. Especially my potassium was at a critically low level and my magnesium was critically low. And when your potassium's critically low, your heart can go too fast and just stop. You go into fibrillation and spasming and not work right. And so they had to give me a lot of potassium. So with weight loss tips, we always give people some potassium to keep the potassium levels at a normal level, to replace anything you're losing through the ketosis, because even when you're losing weight, you will lose potassium through the kidneys to normalize your pH, because you go into an acidosis. It's not as bad as a diabetic ketoacidosis, but it is a ketoacidosis. Now, the other thing you lose is minerals, so your electrolytes in your blood, and your electrolytes keep you alive. You know, sodium, potassium, phosphorus, magnesium, manganese, all these different minerals. And so those also need to be replaced. And so I highly recommend to people to take potassium, and in addition, take a good multi-mineral, and the best kind is either a multi-mineral aspartate or one called Procell, which is a fulvic humic shale mineral that has a lot of good antiviral fulvic acid in, and the humic acid is good antifungal. So that's a good balance and a good way to go. But taking multiple mineral aspartates is a very well absorbed mineral in capsular form. The Procell is a liquid form. Another thing that's very highly beneficial is taking yerba mate herbal tea. Now, yerba mate is kind of interesting. A lot of people have their daily coffee, and you know, coffee can actually make you more hungry, believe it or not. And caffeine in the coffee can make you lose electrolytes through your kidneys, because it kind of pushes the adrenals and makes the kidneys lose some electrolytes. So coffee isn't real good when you're trying to lose weight. And so yerba mate actually helps the body have energy without the caffeine side effects. Yerba mate has a substance called matine, which is similar to caffeine in its energetic effects, but not having the bad side effects of pushing the kidneys and making you lose electrolytes. So that's another thing that I propose to people. Now, a lot of people, they even can get constipated when they try to lose weight. And so a magnesium supplement is very helpful to keep your bowels moving. And the best magnesium is a magnesium citrate or a magnesium glycinate, because these get the magnesium into the cells better and don't cause as much diarrhea, because taking too much magnesium can make your bowels go a little fast. The other thing that's very beneficial is getting a lemon into you, and the best way is to drink water with it, because you don't want to get dehydrated. Water has 0 calories, but the lemon helps alkalinize. It's a weak acid which actually helps alkalinize the body, which means it brings your pH to a more normal pH, and it flushes and dissolves the fat from the system. So a quart of lemonade with the juice of 1 lemon And maybe if you can't stand just the lemon water, you can put a little stevia in.